Hello there. Thank you for joining this Health Hub. What is Hub? The abbreviation Hub stands for Help Under Blues. That means, obviously, under blues means when you get sick. So you need help under blues. That's This is Consumer's Doctor, Dr. Bengala. Today, we're going to talk about Health Review Authority. Who are these guys? Who are this Health Review Authority? Basically, the Health Review Authority is a public private partnership. The group of members on the board of the Health Review Authority will review the applications of individuals who are rejected for the coverage, health coverage, by the insurance companies or deemed a high cost risk for participating insurers. So, Health Review Authority reviews all these applications who are not eligible to insure. That's where we are addressing. The problem is we have 20, 30 million uninsured in the country. The Health Review Authority will review these applications individually according to why they are not insurable. And Health Review Authority, after reviewing the application, can give a certification for guaranteed coverage. Once you have certification for the guaranteed coverage, insurers are obligated to provide the coverage. If the insurance companies don't participate in this health review authority where they give guaranteed health coverage, if they don't participate, basically they their policies will be minimal because there is an advantage in participating in the health review authority. Once they provide the insurance for the guaranteed health coverage, it benefits the insurance companies because government is guaranteeing, either federal or state. Federal government normally right now Medicare is guaranteed by the federal government. Obviously, we're going to see some reforms in Medicare because health insurance companies require a reform because they have to provide consumers the coverage what they need. If they take the high deductible health plan, which is $3,000 deductible, premiums will be lower. So whatever the money they saved, consumers will put aside into the personal care accounts or health savings accounts. We really need insurance reform. I think the traditional insurance companies needs to go away. Basically, they're not traditional insurance companies is not serving the purpose for average American. They need to come up with deductible plans, 3,000, 5,000, whatever it is. So consumers will get the lower premium policies and they can cover themselves. They will cover themselves up to certain amount. Then insurance companies will take the risk and covering the rest of it. That's where people who don't qualify, they cannot be insured because of the whatever the pre-existing condition, high risk categories, low income categories, including Medicaid. which is covered by the states, will be covered by the states under this umbrella, but they will be given same benefits, and health review authority will give certificate of guaranteed coverage. So the insurers have to issue a policy. As long as the government is giving a guarantee, insurance companies, by participating, it benefits them, and it also they can provide the coverage for the uninsured and lower income category. I see a good benefit having a health review authority. I will be talking more and more about what this health review authority does. And this health review authority is completely autonomous. It is neither under any government agency, it is completely autonomous board. They will decide, and they can issue a certificate of guaranteed coverage for which insurance companies have to abide by it. If they don't participate in it, they're the losers. So by having to participate in this health review authority board, insurance companies are the beneficiaries because they get a lot more enrollees into the plan. If you have any questions about this health review authority, please comment. I'll be discussing more regarding this health review authority board, which is a public private partnership, which makes sense, especially market based healthcare. When we are providing, we are talking about consumers putting in charge. Somewhere the public private partnerships have to participate and make decisions for common folks, especially for vulnerable low income category. If insurance companies deny them, they should be able to go to the review authority, fill up an application, and obviously they have to be citizens. At least they qualify for this application. They have to be citizens at least for 1 year before they're eligible to get a certificate of guaranteed coverage by the health review authority. Please do make some comments, and we can discuss it further in the next episode. Thank you for joining. If you do like this topic, you can subscribe and hit the notification button. And I'll get back to you with your questions in my next episode. Thanks again for joining. Health Hub, and this is Consumers Doctor, Dr. Bengal.